Hi, Dr. Juraschek. It's a real pleasure to welcome you today to this interview. You're a leading clinician scientist in hypertension, nutrition, and health equity. Dr. Juraschek is an associate professor of medicine at Beth Israel Medical Center and Harvard Medical School, where his research focuses on how dietary patterns, metabolic health, and social determinants influence cardiovascular outcomes. He has led multiple landmark studies on lifestyle interventions and blood pressure control, including the recently published GoFresh Trial, which explores how improving food access can reduce hypertension disparities in underserved communities. We're thrilled to have you with us today. Dr. Juraschek, welcome. To set the stage, can you start by sharing what drew you to focus on hypertension and cardiometabolic health?
Sure, and it's such a pleasure to be with you all, and thank you so much for the opportunity to speak about our work. As this audience is probably well aware, cardiovascular disease is a leading killer throughout the United States and the world. And cardiometabolic risk factors are major determinants of cardiovascular disease risk. And hypertension affects about 40% of the US population and is projected to affect over 1.3 billion people worldwide by 2030. So it's a tremendous challenge. And it's a major area of health disparities. So among Black adults, about 55% have high blood pressure or hypertension, more than any other demographic group, representing a major area where we could be doing better in terms of preventing this risk factor, lowering, improving blood pressure, but then also preventing its downstream effects like stroke and cardiovascular events. And so we really wanted to focus on a big problem, a problem that was entwined with health disparities and a focus on health equity in ways that we could improve both access to healthy groceries and healthy food to prevent hypertension, improve blood pressure, but ultimately prevent cardiovascular disease.
Absolutely. I can see how these can be key disparities, in hypertension, and how could this motivate you into doing what you do today. So when we talk about lifestyle and dietary recommendations, how do real-world barriers like limited access to healthy food, affordability challenges, or even environmental constraints shape the gap between what guidelines advise and what patients are actually able to do in daily life?
That's such a great question. As a general internist, we commonly talk about diet with a number of our patients and go through principles of healthy eating. And there's some great evidence as to what those principles should be. We have the Mediterranean diet from the trial Predimed, but we also have the DASH diet for blood pressure reduction and hypertension prevention. And in counseling patients, I'll frequently go through DASH principles, emphasizing fruits and vegetables, low fat dairy, lean meats, restricted in sweets and saturated fat. So I'll go through the list. And then over time, I began to realize that for me in my academic setting and maybe in my neighborhood, it's not all that difficult to go down the street to our grocery store and follow the checklist for the DASH diet and try to apply that science and evidence base in my real world setting with my family. But when I was speaking to a lot of my patients, I realized, well, this isn't as easy to access or to implement in their day-to-day life, in part because of where they lived and the community they were coming from. And as a result of that, it was both more expensive, but also more difficult to follow a DASH pattern diet. And as a result of that, we're also pressured in our day-to-day life. Groceries are increasingly expensive. People make trade-offs, and often faster foods can be not DASH concordant by any means and can actually worsen cardiometabolic risk factors like blood pressure. Also, not having available fresh produce, but needing to go to maybe a local place where there is kind of more processed or higher sodium less perishable foods can also be problematic in terms of optimizing health. And so, and yet, if that's what's convenient or available or affordable, all of these factors can influence people's food choices and what they ultimately eat.